Some of you may have heard the term nerve hydrodissection. I talk about it a lot. Other providers are starting to talk about it a lot more. But what does that really mean? In this video, I'm going to describe what nerve hydrodissection is. And then in other videos, I will talk about what things it can help and get into the nitty-gritty details. So nerve hydrodissection is a non-surgical technique. This is not surgery, where we are using a needle to inject fluid around a nerve. Now, this is different than a nerve block. In nerve block, you just kind of get the needle semi-close and you just kind of dump fluid around. Nerve hydrodissection, there is an art to this. We have to be very meticulous because what we're doing is we're using the force of the fluid when we inject to actually separate the nerve from the surrounding fascial layers. And we don't just do this in one little spot. We're often doing this along a larger length or a longer length of this nerve. We will use this to treat fascial entrapments of the nerve. So the most common example you can think of is carpal tunnel syndrome. Carpal tunnel syndrome, you're going to have compression of that nerve within the carpal tunnel by that transverse carpal ligament. In a situation like that, we would use nerve hydrodissection with dextrose, D5W. Sometimes we use stem cells, PRP, platelet lysate, A2M. There's different things we can use. But our goal here is to actually separate out that nerve from the surrounding tissue with the fluid force.